Good afternoon. Welcome and thank you for joining me this afternoon. I'm Scott Harris. I'm State Health Officer with the Alabama Department of Public Health. We appreciate you coming to listen to this news conference today. We wanted to take this time today just to update the people of Alabama on the status of the coronavirus or COVID-19 infections that have been reported around the country and around the world. At this time, we still have not identified cases of coronavirus infection in our state. I wanted to make sure to state that explicitly today. We're well aware that there are rumors around on social media and other places, phone calls and many others who claim to have knowledge of those infections. We do not have any confirmed cases of COVID-19 or coronavirus infection in our state. I have checked just again in the last 15 minutes. There are no positive tests from public health, and there are no positive tests from the private laboratories that are providing testing services in our state and that are required to report their results to public health. We certainly understand that people have a lot of anxiety and fear about this. It's certainly frightening to see what's going on all over the country and all throughout the world. And so I think many times anxiety can cause people to believe these rumors and to spread these rumors. So we just wanted to assure you that we will absolutely let the people of Alabama know as soon as we find out about a case. We have a process in place to make sure that the public is protected and that the public finds out exactly what information that we have while still respecting the privacy of the person who may be infected. Our plan and procedure is to immediately issue to the public the county of residence of someone who we find out is infected, and we will do that as soon as we can possibly do that once we know about a case. We want to remind you that if you're someone who is worried about being infected yourself and wish to seek help, we would ask you first to pick up the phone, first call your own healthcare provider and talk to your healthcare provider about whether you need to be tested. Your healthcare provider can ask you a few simple questions, can help determine whether you meet the suspicion that he or she would have to have you tested. And then if you need to be tested, your provider can contact us at the Alabama Department of Public Health, and we will arrange that testing for you. We are not doing testing at county health departments. We would ask the public not to show up at county health departments because we do not have the ability to screen you and test you in those facilities. All tests are actually done at the state lab here in Montgomery by public health. However, you can be screened in many locations, and screening is a lot like receiving a flu test where you have a swab in your nose or a swab in your mouth. That can be done at a lot of locations around the state, and public health will be happy to arrange that and then transport your specimen here to Montgomery for testing. We know that there are a lot of events happening today, and I'm sure you've heard many things about sporting events being canceled and entertainment events being canceled. I wanted to make a recommendation to you today as our state health officer that we think it would be wise for people to avoid mass gatherings of 500 or more people. A similar recommendation today came out from the health officer in Jefferson County, and I agree with that recommendation and would like to make that to the rest of the state. We have also been in conversation today with the Mobile County Health Department as well. As you may be aware, we have those two metro health departments as well as the state health department in Alabama, and we all want to make sure we're on the same page about that. The number 500 is, by definition, a little bit arbitrary, and I would say that the number of people in a gathering is probably less important than the actual social distancing that goes on. These are the same things that we've been talking about for several weeks now. We would encourage people to use good hygiene, to wash their hands, to avoid touching their face, to cover their cough. And when you're in crowds of people, try to stay at least 6 feet apart. There's something about the coronavirus that 6 feet seems to be an important number and makes it easier to transmit if you're within that distance. So we would encourage people to avoid being within 6 feet if you're out in a crowd, if that's something that's feasible to do. Our recommendation is to avoid public gatherings are not recommendations for workplaces. We are not encouraging workplaces to cancel work. I think it's always prudent to consider whether it's possible for employees to work at home, whether you have HR policies in place in case there should be a reason to have people work from home. But we are not intending for this recommendation today to apply to workplaces. Similarly, we are not recommending that schools be canceled, daycares or institutions of higher education or colleges and universities. This is not a recommendation to cancel those schools or those programs. We've been in conversation very closely with the state superintendent, Dr. Mackey, with all of our colleges and universities, and there are many different factors to consider there. The recommendation that we're making today simply applies to those what we would call mass gatherings, large mass gatherings, 500 or more people. And I think we were thinking of things like sporting events or festivals or other types of entertainment that would have large numbers of people. There are some people, as you know, who are particularly susceptible to infection with the coronavirus and particularly likely to have bad cases. That would be people who are elderly, people that have chronic health problems. And for those people, I would say it's always very prudent to be careful about being in crowds and being around a place where you might contract illness. And that really applies in flu season any year, every year, but particularly at this time as well. So we don't have any other specific guidelines. Again, this is not a health order that we're requiring people to cancel these. This is certainly a case-by-case basis that different organizations and jurisdictions would need to make for yourself. But as state health officer, I believe it's in the best interest of the public health in our state that people consider avoiding these mass gatherings and trying to limit the disease transmission as much as possible. Finally, I'll just reiterate what I said earlier. We do not have any confirmed cases of COVID-19 in our state. We have done testing of many people and do not have any positive test results. The private labs who have done testing have also not identified any positive lab results. We continue to test. We fully expect that in the coming days we will find cases, but at this time we do not have them. So finally, I want to thank the people of Alabama for staying tuned and trying to stay informed about this. It's a very fast-moving situation. There are changes that are occurring all the time, and our guidance is different, and many things are just almost happening too quickly to keep up with. But I want to assure you that at ADPH, we will let you know as soon as we know about a case and as soon as we have any significant information that the public would want to know. So with that, I think I'll stop my comments, but I'm happy to take questions from you here.
Scott, do you have any people waiting on tests as we speak right now?
And can they hear your question, or would you like me to repeat that? The question was, are there people who are waiting on tests? There are some tests, I think, that came in later today that are still being run and are not finalized for today. But we continue to receive tests daily now that we've been testing for 1 week, I believe, and all those tests are negative. And there may be a handful today that haven't come off today. I'm not sure about that, but I think probably at least a couple.
Okay. How many are outstanding, if you will?
I don't know for sure. When I got an update from the lab earlier, I was told there weren't a large number today that had not been completed. I would certainly say in the single digits, but I don't know for certain. Yes.
How many people have we tested total, and what is our capacity for testing? How many tests do we have in hand?
Sure. The actual number I'm not positive because it's difficult to keep track in the sense that one test kit doesn't equal one patient. Multiple specimens might be obtained on a single patient, and so we can use test kits, more than one test kit on a single patient. We also use some swabs for quality control, so there's not a one-to-one correlation. The number that I heard, honestly, was late yesterday. I'm not sure about today. Is something less than 50, but I don't know for sure what that number is. That doesn't count the ones who have been tested by private labs, and doesn't count the ones that were originally sent to CDC earlier before we began our own state testing. I'm sorry, could I finish? Sure. I'm sorry, just 1 second. And then to follow up on capacity question, we right now have plenty of capacity. We do not have any issues with handling the load that we have. We have the ability to run about 150 tests per day if we need to do that, and we have adequate material to allow us to do that. We have used the first allotment of tests we originally received. We have had requested and have already received a second allotment from CDC and are making requests for additional tests as well. So testing capacity has not been an issue for us so far. If we were to have an issue with capacity, our plan would be to try to outsource that overflow to commercial labs that would be able to handle that. I'm sorry, go ahead.
So you would not say that we have such limited resources that there must be cases out there? You're not going to make that statement, in other words, we have the one lab, I guess, in Montgomery, but isn't it likely that we're only one of 5 states in the union that has no cases right now, that there must be somebody out there with us?
Oh, yeah, I think we've been very clear about that. I expect that there are people who are infected that we have not picked up at this point. I think that's very clear. We hope as we continue to test to pick them up. Remember, probably 80% of people who are infected don't have serious symptoms, and so it certainly may be that a number of people have just not sought medical care if they don't seem to be that ill. But as we increase the ability to test more, we think we will pick people up. We want to make sure that we're not a barrier to people being tested, and we have discussed ways to make sure that providers can get a test if they choose to do that. We have criteria that we have put in place based on what CDC has recommended to prioritize those people who are most at risk for getting infected because they've had an exposure or they have a certain travel history. But also we want to prioritize those people who are most likely to have problems because they're elderly or because they're seriously ill already in the hospital. And we still think those are the people who are the highest priority for testing. However, if a clinician feels like they have a patient who needs to be tested, we'll essentially accept that at the word of the clinician, and we'll test that on the order of the provider.
Just on the real micro level here, somebody watching in Birmingham or Homewood or Bessemer, just the one individual who might be watching is a little scared tonight. Walk me through what that person can't. I know one size doesn't fit all, but I'm worried that maybe I have this. You don't want me going to the county health office. Where do you want me going?
Right. If someone is sitting at home tonight and wondering what they should do to get tested, the first thing I would say is don't go anywhere at all, but rather pick up the phone if that's an option for you to do so. If you have a provider relationship, if you have a family physician or a clinic that you use that you know, please call them and talk to a healthcare professional who can ask you a few simple screening questions and help determine if you need to be tested. Most people who are worried about whether they should be tested may not need to be tested, but certainly only you and your healthcare provider can make that decision. So once your healthcare provider has decided that perhaps you do need to be tested, then they will contact us and we will arrange for testing to happen. There are certainly people in our state that don't have access to a healthcare provider. Perhaps they don't have insurance or they just don't have a physician that they have an established relationship with. What we would ask you to do, again, is pick up the phone. Call an urgent care clinic, possibly, or a community health center nearby. Call an emergency department if you need to, and try to ask for information and try to make it so a determination can be made whether you need to be screened or not. If there's the advice based on what that health professional tells you that you need to be screened, that health professional can contact us and we'll arrange for testing to occur. Yeah.
Question, what would you tell people who are getting ready to take off for spring break? They're making plans for trips. What advice do you have for them?
Yeah, as spring break approaches, we know a lot of people will be traveling. I would say that the first thing is just to be aware of the situation. The situation is changing very quickly, and in real time, we're seeing disease pop up in different places. At this time, the true hotspots that we know about in the U.S. are in California, they're in the Seattle area, and they're in New Rochelle, Washington, just north of New York City. Those places clearly have a high level of community transmission and ought to be avoided by travelers. With respect to other locations, we don't have concrete guidance on that, but I think all people should be prudent. We know that there are cases that have been identified in just about every state, even in Alabama where we've not identified a case. I don't think there's any doubt that we probably have disease circulating to some degree, or at least isolated cases. So I would ask people to try to think about whether their travel is essential or not, whether this is a good time for them to be doing that. Certainly people that have chronic chronic health problems or who are elderly ought to do their best to be prudent and stay away from groups of people where they might contract illness.
A little bit of good news here. What is your reaction to what seems to be happening or not happening in China, where all this began? I guess going back 3 months now. These new cases seem to be dwindling to single digits by the day. So, can we extrapolate something from that?
Yeah, I think it's hard to know. There's certainly not a direct correlation necessarily. There are a lot of factors different between what's happening in China and what's happening in other parts of the world. But clearly the disease there has been going on since certainly early December and perhaps even in November. Now we're almost in mid-March and we finally see a decline in the numbers of cases. I think that's similar to what we would expect with any type of outbreak in a way. We do see it dwindle after a few months. I would think even with cases in this country, if we have large numbers of cases, we would expect it to run a certain time course. But really it's just hard to say at this time. A lot has been said about the phrase of flattening the epidemic curve. You may have heard that. And really what that means is even if we have a large number of cases over a short period of time is much more difficult to manage than if we have exactly the same number of cases, but just spread out over a little bit longer amount of time. That allows hospitals to work within their surge capacity, for example. It allows providers not to be overwhelmed. It allows people to get information in a little bit more timely and organized way. So we want to take we want to make all the interventions we can to make sure we do flatten this curve, to make sure that if there is transmission that's occurring regularly in our state, it's happening at a pace that we can manage within the resources that we have. Yes. Yeah.
Go ahead.
No, I was going to ask, do you have any information on how many patients right now might be showing symptoms or might be waiting on tests?
I don't know the answer to that. I'm not sure. I will tell you that we have had clinicians who've called us about patients when we began testing earlier that were clearly not appropriate candidates for testing based on the criteria that we have. Now that we have liberalized those criteria, I don't believe that will be an issue. If a clinician in his or her clinical judgment feels like a patient needs to be tested, we will do that test for them.
Can you discuss what is the criteria on who gets a test? And the plans for the $5 million supplemental.
Sure. In terms of who get the test, is that a question about who actually gets screened, who we're able to screen? I think the simplest answer is if a clinician has a patient they want to be screened, then we will certainly do that. If there's an issue or a problem getting that done promptly, they also have the opportunity to send those people to commercial labs, and we think that's a terrific idea as well. We want all people who need to be screened in the minds of their practitioners to make sure that they get screened. The criteria we have really prioritize those people who are most at risk for serious illness or those people who are most at risk for actually catching the disease. So our prioritization includes people that have fever or cough or shortness of breath or similar symptoms indicating respiratory tract infection, and they have either come from a part of the world like China where there's intense local transmission going on, or they've been exposed to a known case. Perhaps they're a family member or a close contact of someone who's a known case, or similarly a healthcare worker who is caring for someone who's a known case, because those people are certainly at very high risk for having the disease, and if they have symptoms, we absolutely want to prioritize testing for those people. Additionally, we have added the criteria of people who are over 65 or people who have chronic health problems who have symptoms. If those people need to be tested, we certainly want to make sure that they get tested. Finally, if we have people who are hospitalized with similar symptoms, that is, they're sick enough to be in the hospital, and if there's no other clear explanation for what's going on, we certainly want to make sure we test those people as well. People who have serious illness without an obvious explanation, we want to make sure we test them as well. So those would be our priority groups. Those are the ones that we feel like our test is most likely to give good information that could make a difference. But again, at the same time, if providers have other patients that they would like to test, then we'll take them at their word and make sure that they're able to get tested. The second part of your question had to do with the supplemental budget appropriation that was passed today, and as I understand, was signed by the governor today. That was a budget appropriation that the legislature wanted to distribute after talking with public health and with some other groups over the past several days. They want to make sure that while we're waiting on federal funds to come down from what the U.S. Congress passed last week, that we would have the ability to make sure we keep up with any demand for testing and demand for screening. So the plan is still being developed, but generally speaking, we will make sure that there are areas where people can be screened around the state. I don't know exactly what the number will be, but we'll have them perhaps not in every single county, but we'll have them around the state so that people have access to be tested, or to be screened rather, and have their specimens collected so that we can test them. Even if there's not a screening center that's going to be located in a particular county, we still have the ability to work with local hospitals in other counties or with certain clinics in other counties so that we can get people screened wherever they are should the need arise for that.
They'll be screened to see if they need a test, or can they walk in and say, I need a test?
Right. So the screening is actually collecting a specimen. So at that point, a decision would have been made that they need to be tested. And so we still think it's prudent at this time for them to go through a provider. Part of the plan involves developing a way for people without a provider to receive some type of consultation so that they can be approved for a screening if they need to have that. At this time, the plan is not to open it up to the public necessarily to walk in and ask for a test. That may become necessary at some point, depending on what we see. But at this time, we feel like those tests ought to be prioritized for someone that a physician or other provider has seen or at least spoken with and made a decision that they ought to be tested.
And will there be a cost to the person or their insurance? If they
There's not a cost